Welcome to the AARDY.com YouTube channel for travel tips. I'm Jonathan Breeze, the CEO, and today's topic, healthcare abroad. Well, our friends at the CDC have some great advice about healthcare abroad that we are happy to share, and here's what they have to say. The quality and availability of medical care abroad may be variable. Before departure, travellers should consider how they would access healthcare during their trip should a medical problem or emergency arise. So travellers may seek medical care for a variety of reasons, ranging from minor infections to major illness or injury. Some insurance plans cover emergency healthcare, but travellers should check with their carrier to confirm what coverage is offered and what requirements exist. At a minimum, travellers may need to provide copies of bills and invoices to initiate reimbursement. Emergency health coverage does not usually cover emergency evacuation or the cost of altered itineraries. Travellers may purchase specific policies to cover these expenses, understanding that such policies often do not cover expenses related to pre-existing conditions. In addition to identifying quality healthcare, travellers, especially those with chronic or complicated medical issues, should know the names of their chronic conditions and allergies, their blood type, and current medications, including the generic names, ideally in the local language. Travellers should also wear medical identification jewellery, such as a medic alert bracelet, if appropriate. There are a number of cellular telephone applications that enable travellers to download their medical records, medications, EKG, and other information so that it is accessible if needed. Now, before going abroad, travellers should identify healthcare providers and facilities at their destination. This is especially true for travellers with pre-existing or complicated medical issues. Travellers who require regular dialysis need to arrange appointments at an adequate clinic site. So similarly, pregnant travellers should identify reliable health facilities. Now, more choices are generally available in urban areas than in rural or remote areas. Travellers should evaluate their health before travel to ensure that they are healthy enough for their itinerary and should avoid travel if they become ill before or during their trip. And travellers may be reluctant to postpone or cancel a trip when ill because of their financial investment in a trip, among other factors. However, some airlines check for visibly sick passengers in the waiting area and during boarding. If a passenger looks visibly ill, the airline may prohibit that person from boarding. Encouraging travellers, especially those with chronic or complicated health conditions, to purchase trip cancellation insurance, which will protect some or all of the investment in a trip, may increase compliance with this recommendation. So that's the advice from the CDC. Our advice at AARDY.com is that we recommend a traveller pack travel insurance whenever they are leaving home. You can get an anonymous quote in seconds and compare dozens of the top travel plans from many of the largest US travel insurers, saving you time and money finding the right plan for your needs. Safe travels.